One of the most abused drugs in the world is marijuana. Cannabis is another name for marijuana, which is a psychoactive drug derived from the cannabis plant. Native to Central and South Asia, the cannabis plant has been used for thousands of years in traditional medical as well as a drug for entheogenic and recreational purpose. The drug was mostly found in the flower and known as buds and much less in seed, leaf, and stem of the plant. Undeniably, marijuana has medical function. Cannabis is frequently used by people to treat nerve pain and multiple sclerosis. Additionally, it is used to treat migraines, nausea, and vomiting, but there is no any solid scientific evidence to back up this application. However, recent studies have confirmed and extended early findings, such as the fact that human performance on complex machinery can be impaired for up to 24 hours after smoking as little as 20 mg of THC in cannabis. Learning ability and other acute effects of cannabis use have long been known. Marijuana is the most normally legal in the drug in US and other countries around the world. According to the organization, 147 million people, or 2.5% of the world population, use cannabis, compared to 0.2% who use the cocaine and 0.2% who use opiates. Since the 1960s, the use of marijuana has grew rapidly in popularity in developed nations like Australia, Western Europe, and North America. Marijuana explosive growth has made it more closely associated with young culture, and the age of initiation is typically lower than for other drugs. On 9 June 2022, Thailand legalized the growing of marijuana and its consumption in food and fuel. It has been raising concern and discussion from people around the world. A very good morning to Ms. Noor Alia and all fellow audience. Today, I want to talk about the reason marijuana should not be legal in the country. There are widespread off-label use, contamination, concentration, and route of administration, and effect of connection. The first reason of marijuana should not be legal in a country is widespread off-label use. If a country legalizing marijuana, since marijuana would not be under centralized regulator control, it would be vary from other prescription drug used for medical purpose. Marijuana can be planted by anyone in a dispensary or farm. For example, in US, depending on the state, the growing standard can vary from strict to almost non-existent. The raw marijuana plant and its product face the risk of becoming mold or fungus infected. It has been caused problematic for the patient who has the immunity problem. Based on May 2013, Food and Drug Administration, or we call FDA, has been approved THC and THC analog can be used already. Those drugs are used for cure HIV or AIDS cases and chemotherapy associated nausea and vomiting. This medication has been approved in clinical trials that are safe to use unlike smoke and crowd marijuana. However, majority of the medical marijuana is used for non-specific pain or muscle spasms, although marijuana compounds have the high-quality clinical trial. Recent data show that Colorado and California showed that 94% patients who have medical marijuana card use them for treatment of several pain. Based on the evidence from clinical trial, show that benefit of marijuana is neuropathic pain, but there is no high-quality result show that drug reduce non-neuropathic pain. So we can conclude that the medical marijuana still showing a lack of sufficient data to demonstrate the risk of medical marijuana. Also, legalizing marijuana may enhance the opportunity of the people who sells the marijuana in the black market. Cutters can easily undercut the cost of state license, seller price, and tax. These marijuana sources are frequently unreliable because marijuana is frequently procured, grown, and transported using risky methods. The second reason of marijuana should not be legal in the country is contamination, concentration, and route of administration. Based on the Med 2013 in US, medical marijuana is not governed by the Central Regulator Agency. Unlike any other prescription drug used for medical purpose, marijuana is planted in dispensary, which, depending on the state, may or may not have strict regulator standard. Mold or fungi may be present in the unprocessed of undefined marijuana plant and its product. For people with compromised immune system, such as those with HIV, AIDS, or cancer, this is especially problematic to them. Additionally, raw marijuana include more than 60 active cannabinoids. However, marijuana cultivators frequently breed cannabis plants to change the concentration of various chemical compounds. For instance, the main psychoactive ingredient, tetrahydrocannabinol, or we call THC, is present in greater concentrations than 20 times those of marijuana produced from decades past. Hence, without extensive clinical trial, there is no way to know which marijuana combination may be advantageous or harmful. The only medication that is smoked is marijuana, and while the long-term effects of marijuana smoke on the lung are still poorly understood, there are valid concerns. Smoke from marijuana can produce 4 times as much carbon as 3 times as much of monoxide to be inhaled when compared to cigarette smoke. Furthermore, although not in all studies, marijuana smoking has been linked to the increased risk of lung cancer. The third reason of marijuana should not be legal in a country is effect on cognition. The early studies show that the early and heavy use of marijuana have relationship with the cognitive decline. This decline persists after the actual cannabis intoxication period ends, based on the mere capture amber and Morphis in 2012. The study, which is follow subject from birth to age 38 marijuana use, the results show that when it started in adolescence, was linked to the multiple types of cognitive impairment such as executive function, processing speed, memory, perceptual reasoning, and verbal comprehension. But some of the researchers critiques the study, claiming that the results were different due to the socioeconomic status. However, the result from the original study suggests that socioeconomic status was not affect the factor due to the use of marijuana was just as common in population with higher socioeconomic status. Furthermore, acute marijuana intoxication is linked to the behavioral disinhibition, impulsivity, and impairment of working and episodic memory, which can affect performance in day-to-day activity. For instance, a meta-analysis from 2016 indicated that cannabis users had a 36% higher risk of being in a car accident than non-users. The use of other drugs and the development of tolerance can both affect the short-term effect of cannabinoids according to the evidence. According to MD 2020, compared to their childhood IQ, long-term marijuana users showed a decline in IQ, as well as slower learning and processing speed. Those who knew them well say that struggling with memory and focus. Long-term marijuana user IQ as children were average 99.3, but their IQ as adults were below average 93.8. Their mean 5.5 point IQ decline from childhood to adulthood was noticeably greater than seen among marijuana non-users for their entry life. In conclusion, there is some evidence to suggest that specific naturally occurring marijuana compounds can treat the symptoms of illness like cancer, HIV, AIDS, and multiple sclerosis. If these drugs are to be used as medical marijuana rather than by popular vote or state legislator, they should go through the same rigorous permitting process as other medication prescribed by doctor, which includes randomized and active control trial to assess safety and efficiency. Furthermore, guarantee the purity and concentration of the medication and enable the recall of tainted batch These therapeutic compounds should be given via a route that reduce the risk of long-term healthy, such as oral pill. Marijuana used for medical purpose has a lot of detrimental healthy effect. The drug is addictive, and there is mounting proof that the withdrawal syndrome can occur. Doctor regarding the most popular illegal Doctor education regarding this most popular illegal substance is currently lacking in resource. Government and related authorities must discuss the pros and cons of legalizing marijuana to avoid irreparable situation. That's all from me. Thank you.